the station taking action for you. This is ABC Action News.
Good afternoon. Thanks for joining us this Tuesday. I'm Dan Schaefer.
And I'm Dee O'Reilly. Flu season is hitting the country early and also hitting hard. Health experts say this is the earliest start to a flu season in about a decade. 41 states, including Florida, are reporting widespread cases. So far, 2,200 people have been hospitalized because of the flu. 18 children have died. The latest is a 15-year-old Michigan boy. Joshua Paulina passed away over the weekend. He didn't get a flu shot, but doctors reportedly told his family that in his case, it would not have made a difference. Our Bill Logan has been on the phone with health officials in the Bay Area all morning, checking up on the flu season here. He joins us now with the details. What are they telling you about how bad it is here or how good it is?
It's bad, but not as bad as it is in other areas of the country, Dia, and certainly not as bad as it is in other areas of the state. This new flu strain, this H3N2 flu, is hitting us hard here across the state, but not as hard as other areas. And at least it's not getting bad here because so far we're doing all the right things.
Okay, we got one over here, baby doll. Here's your flu shot. Ooh, yay!
This has been the biggest impact of the flu locally as folks flock to doctors, clinics, and here to the health department for a flu shot. It's the best way to protect yourself against the current H3N2 strain of the flu that's been going around. And while areas like the Panhandle, Central, and South Florida have been hit harder this season, we here in the Bay Area have dodged the bullet, sort of.
We have not been notified of any negative impact on the hospitals. We have seen increased visits through our emergency room data. We're getting notified by our hospitals that we are seeing increases in influenza illness.
I've checked with hospitals on both sides of the bay this morning, and from Morton Plant Mease to TGH, officials say they're monitoring the situation and taking proactive measures like encouraging or mandating that their staff get the shots, and they're telling visitors with flu-like symptoms to stay away from patients if at all possible. But that's pretty standard stuff, according to Warren McDougall, who's been tracking flus for the past 7 seasons with the health department through vaccine shortages, the H1N1 scare, and now this. He told me that this year the flu is hitting harder sooner, but it's not a crippling strain. And when I asked him point blank if we need to be worried,
I would say that you protect yourself. You won't have to worry about the flu. Get your flu shot, wash your hands, cover your sneeze and cough, and if you're sick, please stay home.
and that is truly the bottom line here. There's no sense trying to be a hero and toughing it out, because what you could end up doing is infecting your whole office. And one more thing to know, if you've had that flu vaccine, that shot, it takes 2 weeks for it to be totally effective. So all of those precautions that Warren was talking about, go ahead and keep them in mind as you go through your day-to-day activities. Reporting live in Tampa this noon, Bill Logan, ABC Action News.